So this is a course meant for TMD assistants, and it reviews the critical exercises that we give patients to assist the patients in healing. A lot of these exercises are done at specific points in treatment, and we're just going to be going over them. You should understand also that we have the actual handouts that you can read, you should read, and perhaps at times demonstrate these exercises to another assistant just to get used to doing them. So when it comes time to demonstrate them with patients, you'll be able to do it. And again, the Atlanta TMD Institute was created to educate dental and medical professionals in TMD, which we're doing with you right now, to develop knowledge of temporomandibular disorders, and to successfully treat patients suffering with TMD. And again, this is the second thing that by learning this course, you're assisting in successfully treating patients who perhaps have gone to other practitioners, and you are doing it right now. You're doing it well. Learn what you're doing because you are assisting people, and it's a spiritual journey, not just a job. It's a career with some seriously wonderful things. There are quite a lot of TMD handouts that we give to patients to help the patients remember how you educated them. What's critical is to understand that you are educating the patient personally, one-on-one. You're the teacher, the instructor. The handouts are to supplement or be extra so they can remember what you taught them. This is a critical idea. It's a critical concept. You are the teacher. Please don't let the handouts be the teacher. The handouts should never be the teacher. You're the teacher. So there are several handouts or their home assignments that we regularly give to TMD patients, and this particular course is going to review these handouts and teach you basics about them. I just love commonly asked questions. I had invented this, I guess, like 20 years ago, and it allows me to document, write up, show you something you can go back to see, document many, many different things. It was primarily for telephone use because so many of the front office staff don't understand the legal aspects of answering the telephone and lying to patients. You can't lie even accidentally. I did this, but then as the commonly asked questions grew and grew and grew, we developed an area called forms, and I have them circled there. And the forms are all documents that you give to patients generally. So be sure that there's a commonly asked questions file on every one of the computers that you use. You are welcome to copy it, bring it home, and go through it. It's an education, the whole thing. If you go through this completely and you learn everything in it, you're going to be a pro. You're going to know everything there is to know about dentistry. So again, the main menu is displayed here. Commonly asked question has all the sections and all the other stuff on the bottom. But the segment of the area that we're talking about today is forms. Forms. So I have it circled down there. Now there are lots and lots and lots of different forms because dentistry has many, many different areas of interest. Obviously, oral surgery forms, very important. Root canal forms, forms about a lot of different things. But the purpose of today's video is temporomandibular disorders. So we have a forms page just for temporomandibular disorders so we don't clutter up things. You are a temporomandibular disorder expert, so you need to know every one of the forms inside the temporomandibular disorders page. But the way you get there is you simply click on the top left side and it will open up all of the temporomandibular disorders forms in the page. You should know every one. So you should spend some time reading, carefully thinking about each one, saying, well, gee, why does Dr. Podolsky give this particular form to the patient? What is the purpose of this form? What am I trying to do with the patient when I have this patient read or sign, or whenever I give the patient this form, or do a one-on-one educational cycle with the patient? So this is the top of the temporomandibular disorders forms page. You'll notice that it's too big to put on the screen directly. So you're looking at the top of the page here, and it's broken out into different areas. Consent forms. We cannot treat the patient without a consent form. We cannot. We cannot. We cannot. We should not. We're not. You are in charge of ensuring that all consent forms are reviewed with the patient, questions asked, and the patient signs these consent forms, because patients can be really weird. I've got stories, if you want me to tell them to you, that you would not believe. Most honest, I mean, the craziest things you've ever seen. Some people say TMD patients are crazy and they don't want to treat them. Uh, I think all pain patients tend to be difficult to work with because when they're in pain, they don't listen well. And sometimes they get crazy. I mean, they really do. But, you know, go through the names on all of these things and say, why does Dr. Podolsky have this particular form in the temporomandibular disorders forms page, and why should I know it? Why should I give it to a patient? When should I suggest that the patient get a copy of this, or I print a copy of it? What is it all about? Okay, very important. Here's a list of the common TMD, temporomandibular disorder exercises that we give to patients to accomplish specific behaviors or tasks. Um, you need to know these, each one of them, and I'll be updating them. So this is an older version, most likely from the one you'll see. But one of the most important ones is exercise one, training you to bite into your new bite. We give patients these handouts so that they will have something when they get home to remember how to do what you taught them to do. But honestly, you are supposed to teach them how to do these exercises chairside, one-on-one, you and the patient, so that you know in your heart that that patient knows how to do these exercises. It's not just giving a handout to somebody. I have a terrible criticism of a lot of physical therapists who do not wish to do what we call manual therapy, hands-on therapy, and they don't want to work hard. They don't want to take care of the patients. Patients don't get better very often, and they just hand them handouts. Well, here's an exercise for you, and they hand the handout to the patient, and the patient never gets better. And you don't want to fall into that same terrible, terrible, unethical, just rotten behavior. So these exercises are extremely important. They are given to patients. You give them to patients. You review them one-on-one with the patients to create a bond with you and the patient, so the patient will call you if there's any issues or questions, because we want our patients to get better. We want our patients to get better. Oh my God. And you know someone by what they do, not what they say. So I think it's critical that your behavior is totally ethical, meaning you're doing the right thing for these patients, and that you want them to get better in your heart. It's a deep thing, and you want to very much for them to get better. And so you work with them one-on-one. Isn't it nice that we have these handouts to give to them about what you did with them one-on-one? We don't need the handouts. You should demonstrate to them one-on-one and teach them like an educator how to do each one of these exercises without the handouts. But you're using the handouts to supplement, make something additional to your teaching one-on-one with them. So the set of exercises that you're going to be using the most, no question, the most will be these what I call exercises. Uh, it's interesting, the TMD cervical massage does not have an exercise on it, but it's in the exercise section. I am updating these exercises, so there'll be some slight variations when I update commonly asked questions in this particular form. But you must know every one of these. This is an order, not a request. You're going to be learning them and educating one-on-one with the patient. You're going to be sitting with me, and you're going to become a key person in the treatment of patients. You're actually going to be possibly the most important person because you spend way more time one-on-one with the patient than I should. You should be doing every legal thing that you could possibly do with the patient, taking my place, freeing me up to see more patients and help more people. It's one of the reasons why I teach is because I can help more patients by teaching doctors because they'll take care of patients for me in their offices. And more, thousands of people will be taken care of without me even being present, but my thoughts and my techniques all are written out in ways that are easily understood. So these are one-on-one exercises. One-on-one means you personally look in the mirror. Please understand, you must teach the patient these exercises. I want to say something again and again and again. We don't need these handouts. You should be demonstrating these exercises to the patient so that the patient understands it without any of these handouts. Do you got it? Because a lot of my assistants believe that all they have to do is hand this thing to the patient. A lot of people are illiterate. I mean, they're functionally illiterate, meaning, yeah, they can read, but they don't want to read and they don't read. So giving them this handout, yeah, okay, yeah, it's good. Absolutely. That's why I did it. It's also good because you'll know what each one of these things are saying. And it's also good because legally in a court of law, you write these into the notes, you personally write this into the note for the day that you went over these uh, exercises and that they got a copy of this exercise because later they'll claim you were incompetent, you never told them, you taught them wrong. Well, guess what? You can't teach them wrong when you hand these handouts because the judge is going to see the exercise and he'll know that you taught the patient this exercise. So part of this is just legal stuff uh, because patients do turn on us, and it's true. It's the sad part of my existence. Other dentists also turn on us. There's a lot of jealousy and there's a lot of controversy. And I am an expert. I'm a little arrogant. I'm excellent at what I do. And I really truly believe that I am the best TMD practitioner in the state, perhaps even the Southeast United States. I take care of everything and anything, and I do well. I'm an intellectual. I look into things. I try to solve problems. And there are a lot of jealous people, and absolutely, we've had other dentists complain and make me miserable, but this is the way it is. So I'm always concerned about legalities, and these handouts give me a legal basis to state that I taught this patient this, you taught this patient this, and this is what we taught them. So if they're doing something wrong and some terrible problem happens, God forbid, uh, we can prove that they did that, that we did not do it, that we can prove what we taught them. We're going to begin with probably the most common, most important exercise, TMD Exercise 1, training you to bite into your new bite. What's that mean? Okay. New bite means a different bite from your old bite. The old bite is when you bit down and your teeth fit together, but that is where you jammed your joints. So I created a new bite using plastic or orthodontic acrylic. A new bite that makes the face look better, that makes the joints better, lips better, everything is better, more room for the tongue. Although when we put the appliances in, of course, during that period of time, the appliances are taking up some of the room that the tongue wants. But it is a new bite, and we call it the therapeutic bite therapy. These patients are going through TMD therapy, which is a continuous treatment. Therapeutic therapy bite. It's the treatment bite that I determine, and you're going to get excellent at helping me do this too. So this exercise trains the patient to learn their new bite, all right? So to bite what? Actually bite into this bite. They bite very precisely, excellently, accurately, right into the bite that I created. You will learn more and more about the mandibular orthopedic repositioning appliance. We call it the hard guard and how it works. And we hinge, which is like a door opening, into the bite. So they bite into it, they open, they bite into it. It's exact. There's no sliding around. It goes right in. You don't open and close the door and it goes into different places. The door always closes into its jam correctly. They have to bite up and down into this new therapeutic bite, which is created by the mandibular orthopedic repositioning appliance. And you are going to teach the patient how to do this. And this is a big thing. Well, there's no question that this is probably the most important exercise. Why? Because you know every single patient that is getting a hard guard or mora must get this handout, which is exercise 1, training you to bite into your new bite. You personally, please listen up. You must ensure that the patient is given a copy of this. So if it has not been printed out ahead of time, please print it out. 2 copies, one for you, one for the patient. You read it with the patient. One of the things I am struggling in my heart to do is create an organization where we all work together. You do as much as you possibly can so that I can see more patients. And guess what? The administrative support staff are supposed to do everything they can in order to get you to see as many patients as you can. And so this handout, TMD Exercise 1, training you to bite into your new bite, must have been printed out the day before. If it wasn't, that means that somebody is not doing their job. And the most unfortunate, most sad thing in the universe is enabling incompetent people. In other words, you wouldn't do this with your kid. Like if you did your kid's homework, you're an idiot. And your kid's never going to learn. So if you are enabling an alcoholic by giving them alcohol, if you are enabling a staff member who's supposed to be printing this out every time they see DHG and it's not printed out, they're not doing their job. You should say something about it, like a parent that would say something about a kid. So this exercise is always given to deliver hard guard DHG patients on the day of the hard guard delivery. You give it to them, but again, you work with them so that they understand what is inside this handout. The TMD assistant carefully reviews this handout and works with the patient one-on-one to ensure that the patient, get this, knows how to do the exercise. Patient should be able to go home with no misunderstandings, clearly be able to execute this exercise with a mirror because you ensured that they could do it. This is the most important TMD exercise that we have, since the patient's TMD treatment success, the success of this mora, depends upon this patient biting into his or her therapeutic bite. It depends on you being an incredibly wonderful teacher and you ensuring, knowing that they know what they're doing. And I'm going to tell you, you're getting paid to apply love. You're getting paid to be religious. You're getting paid to help other mankind. And here you are, you have the opportunity to help another person one-on-one learn this exercise. You're getting paid to do it. Do it well. Make sure when that patient leaves, they know how to do the front and back pages of this. There's 2 pages, and a lot of times an assistant will do the front one, and later the patient will come back and say, I didn't know I had to swallow water with this. No one told me about it. Yeah, you gave the patient the handout. Yeah, you did some exercises, but you forgot to do the swallow one with them. You, the TMD assistant, must ensure that the patient can do this exercise successfully before the patient is dismissed that day. Very, very important. You are the loving, caring TMD assistant, the loving, caring clinician. You're taking my place to make sure they understand this, and I appreciate that. And I think you're going to do a better job than me because I got lots of thoughts and distractions, whereas you're focused only on this one patient. So I'm going to read the first paragraph of this handout, exercise 1, and then I'm going to talk about it. And you must fully, completely, 100% expertly, just as good as the doctor, understand what's going on so you can explain this to the patient legally accurately, not inaccurately, not your feelings, but what you know scientifically. Your new TMD appliance positions your jaws into a new position when you bite into the TMD appliance. Your upper teeth fit into your appliance when you bite, and this fit changes the position of your jaws when you bite into the acrylic. Dr. Podolsky has carefully chosen this new bite position based on how your face, jaws, and teeth are shaped and positioned. This is called your diagnostic bite. Some doctors call it a therapeutic bite. Dr. Podolsky is testing this new position to see if you get better after wearing the appliance at this new bite for about 6 weeks. Fortunately, most patients do get better. You can do these exercises in front of a large mirror, like a bathroom mirror, or you can use an inexpensive hand mirror from a dollar store. So I read this out with you. Now we're going to briefly talk about each one of the lines so that you can understand and explain any questions that the patient may have and understand what this says. So you know what it says completely, 100%. You're the expert. You could teach someone on, you're going to teach a patient, but you're going to teach another doctor. So your new TMD appliance, we say appliance is the name of it, and it is a jaw positioner, but it only works when they bite into the new bite position that we created on the top of the appliance. So they got to learn how to bite into this new bite position where their upper teeth fit into the grooves and the holes and the ridges of the appliance. So your upper teeth fit into your appliance when you bite. So they only accurately do this when they bite into the bite. So they have to bite into the acrylic to get into the diagnostic therapeutic bite. And they've got to do this over and over and over to get used to it. And when they do fit into this, it is a better position for their face. You can look at their face almost always and see that the chin's in the better place, the lips are fuller, the lines have gone down. It's a non-surgical facelift. And it is carefully constructed by me. I don't just arbitrarily just decide something I want to put it in. Now, it's probably best called a diagnostic bite. What is diagnosis? Diagnosis is finding out what is going on. So if you go and have a sore throat, you go to the doctor and he diagnoses what your problem is and then he treats it, right? Diagnosis means, is it a viral infection? Is it a bacterial infection? If it's a bacterial infection, is it strep? And then once you've got a diagnosis, you treat it, and it should go away if the diagnosis was correct. But all diagnoses are speculations, good educated guesses, and most of the time we're right. So I am choosing a bite position, a face position for this patient based upon what I know, and I'm testing it, right? So it is a test. It's a therapy test. So it's called the Diagnostic Bite because I'm finding out if the bite I gave them is the one that will cure them or get them better. I should never say cure. And I call it the therapeutic bite, but it really probably is more accurately the diagnostic bite. So we're testing the position. It's not permanent. Wait a minute. Make sure you let them know. We are testing this position to see if you get better, right? And I put 6 weeks, but usually it's 3 months. But we let them know we're going to struggle with this for 6 weeks. Makes them happy, and it coincides with the 6 week program that we do for the soft guard. Now the soft guard program is different because it's only with the soft guard, but for 6 weeks we do have the patient continue with the 6 week program, but with the hard guard instead of the soft guard. So fortunately, you reassure them, let them know, listen, you're going to probably get better. Most patients get better. So this is the start. Congratulations. Yeah, you're going to have to put up with some things, but I'm sure you're going to do fine. Now you need to do these exercises in front of a mirror. You can't do it without the mirror. You must actually go into your bathroom with bright lights all over there and bite and watch your teeth over and over and over again, 3-4 times a day. You can also do it with a hand mirror, so they don't have to be in a bathroom, which is kind of nice. And you get dollar store mirrors, and they can use that, keep it in their pocketbook, do it at work, do it in the restroom at work. They can do it at lunch. They can do it anywhere they wish, but they have to do it. That is what you need to encourage them to do multiple times, over and over. So I use a lot of non-professional slang terms. I don't want to give you any bad examples, but I use terms that the patient can understand. So your purpose in teaching the patient this exercise is that the patient understands the exercise. That's your purpose. They should be able to go home and do it. In most cases, the new diagnostic bite is more forward than the old bad bite. In the past, your jaw automatically fell backward into the old bad bite. These exercises help train your jaw and your brain to know where your new bite is. Your goal is to train your jaw muscles to become comfortable in the new diagnostic bite and to effortlessly and automatically go into your new diagnostic bite when you open and close. So think about this. This paragraph here is something that you need to know because when you're watching the patient when they return, are they effortlessly, immediately going automatically without thinking, biting right into the bite that I created on the acrylic? If they're not, they didn't learn it. And they're not at the proficiency level, in other words, they're how well they do it, to where they're going to get better quickly. So then I continue. Place your appliance in your mouth and bite into it. Look into the mirror to see how your lower teeth fit into your TMJ appliance. Open your mouth a few inches and then close back into your new diagnostic bite. If you bite correctly, your teeth should fit back into the appliance exactly the same way as before. If your lower jaw has trouble finding your new diagnostic bite, keep repeating the exercise until you can easily find the new diagnostic bite. Use the mirror to guide your teeth into the new bite each time you close. You should discontinue this exercise when you're comfortably and easily able to get into your new bite without using a mirror. All right, so let's kind of go over this paragraph. It's really, these two paragraphs, they're really important. In most cases, the new diagnostic bite is more forward than the old bite, and that's almost always true because the condyle is jamming and crushing the back of the joint and pressing into the ear, in most cases. In the past, your jaw automatically fell backwards into the old bad bite. Now I use a slang, bad bite. It's a slang. A lot of dentists get bent out of shape about this. They hear, bad bite? Oh my God. So we don't want to get into this, but we use it. So this is the key sentence here. These exercises help train your jaw and your brain. So the brain guides the jaw. When you're walking, the brain guides your legs or your arms or whatever is going on. And so your brain has to learn this new bite, this new diagnostic bite, this new therapeutic bite, and go right into it. But it takes time, it takes training. A dancer just doesn't go out there and dance. Dancer has to practice, practice, practice. And they say, how do you get to Symphony Hall? Practice, practice, practice. So if you have an instrument and you want to be the ultimate who plays in Symphony Hall in New York City, you have to practice, 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 because practice makes perfect. So your goal is to train your muscles to become comfortable in the new diagnostic bite and effortlessly and automatically go into your new diagnostic bite when you open and close. And most of the time, patient comes and says, "I'm really not comfortable with this bite." That means they weren't doing it. They weren't practicing it. I'm sorry, because almost always that bite is going to be harmonious with the length of the muscles, the shapes of the bone, and everything should relax. All the face muscles relax because they're in their right places. And most likely they weren't doing this exercise. They just are not doing it. And they'll give you a lot of bogus excuses. Sometimes it will get emotional. And this is just the way it is. This is human beings. Human beings do not always do what they're told to do. Physicians know that noncompliance, in other words, not doing what you tell them to do, is the number one reason in treatment failure. They know that most patients do not comply. Isn't that sad? Place your appliance in your mouth and bite into it. Look into the mirror to see how your lower teeth fit into your TMJ appliance. You have to have them do this and then have them look in the mirror so that you verify, you personally verify, you know this is the correct bite. So now you're going to tell them this is the correct bite. So they learn the correct bite. If they don't learn the correct bite by you and they leave, they're not going to be able to go into the correct bite because they don't know it because you never taught it to them because you're a jerk. I'm sorry. Open your mouth a few inches and then close back into your new diagnostic bite. If you bite correctly, your teeth should fit back into the appliance exactly the same way as before. Say over and over every time going into the right bite. If your lower jaw has trouble finding your new diagnostic bite, keep repeating the exercise until you can easily find the new diagnostic bite. Some patients need more time to learn. Some people learn it immediately. Seems like young people under 22, amazing. They just are amazing. But as they get older, your body doesn't learn to do things as well. You can't just go out and dance. Look at language. A kid learns language easily when they're under 12 years old or so. You just put them in, they learn automatically. But then you try to teach French to a 35-year-old, much more difficult. Whereas a kid would just pick it up, right? So they have to spend some time on this. So if your lower jaw has trouble finding your new diagnostic bite, keep repeating the exercise. Keep doing it until you can easily find the new diagnostic bite. Use the mirror to guide your teeth into your new bite each time you close. So your eyes now, your vision is working with your teeth and your mouth. You're using senses, additional senses. And then the feeling of the teeth is a sense also. You should discontinue this exercise when you're comfortably and easily able to get into your new bite without using a mirror. So they will learn it and they'll know it. But if they come in after 6, 8 weeks and they don't know it, we got a problem. You got a problem. You're a poo-poo instructor. So you need to update, improve your abilities because you are the one teaching this to them. So we're continuing. It says, at first, open and close slowly. Open, close, open, close. But as you become more comfortable, open and close a little more normally. A little further open, little all the way back, a little more rapidly, all the way back, right? Do not open fast. Do not jerk your mouth open or closed. Repeat this exercise. Get this, guys, 10 times in a row, and then take a rest. So bite 10 times, not once, not twice, not 5, 10 times or more. Each one being successful, verified with the mirror. Then do a second set of 10 and take another rest. So they're doing sets like weightlifting. Finally, repeat the exercise 10 more times. This is referred to as 3 sets of 10. Do 3 sets of 10 for 3 or 4 times each day. So you're going to ask them, how many times did you practice? And they should say 3 times my first couple of days. If they don't know this, they're not doing it. Or you sucked as a teacher. You never really made it clear that even though you gave them a handout, you weren't concerned about them learning it and doing it correctly. So do 3 sets of 10 for 3 or 4 times each day and report your results to the TMD assistant at your next visit. So you want to know the results. Hey, are you doing it? I said, did you learn your therapeutic bite position? You have to ask this. Are you asking it? Oh my Lord. Are you asking it? If you're not, you flunk. You missed a big giant part of your job. This is not a permanent exercise. You do not need to continue to do this exercise after you've learned to get into your new bite by yourself without a mirror. Many patients incorrectly and unfortunately keep doing the exercise and get fixated and frustrated with their new bite. This is really bad. Let your jaw relax and do it at once you've learned how to get into that therapeutic bite. So exercise 1 with a swallow is the exercise that is done after you've pretty much learned regular exercise 1 without water, without liquid, without swallowing. And it's basically putting the icing on the cake because the brain recognizes and identifies the swallowing position, and it's a very, very important position. So the brain will register and remember the swallowing position. So this will aid the patient in more quickly learning this position. So if you see patients who are having trouble finding the therapeutic bite position, you want to work with them one-on-one over and over and over again, but then you want to get some, cup out with some water and do this particular exercise, and you'll find that in some patients, they're going to learn it much better because this is a special activity. Swallowing is a special life-giving activity, right? Putting your jaw together in your therapeutic bite is not a life-giving activity. Swallowing is life-giving. You have to swallow to live. You can bite and you can not bite and live, but swallowing is very important to the brain. So normal patients close their teeth together when they swallow, and this is what we're going to do. A lot of abnormal patients, TMD patients, don't do that. They put their tongue in between. Because of this, your brain knows where it needs to put your lower jaw when you swallow. You are retraining your brain to go into your new therapeutic bite position when you swallow with this swallowing exercise. It is the same exercise as exercise 1, but in this swallowing exercise, you sip some water, place your teeth into your new therapeutic bite position, which you should have learned with the regular exercises, and swallow in this position. Keep repeating this 10 times and take a break. Do this two more times for a total of 3 sets of 10. So whenever a patient does exercises, it's always 3 sets of perfect 10. Each one in the set of 10 has to be correct in order to go on to the second set. So first set 10, second set 10, third set 10. First set done perfectly, second set done perfectly, third set done perfectly, and if there's any interruption where there's a mistake, you have to repeat it over again until you get the 3 perfect sets. Do this swallowing exercise at least 3 times each day, preferably in the morning, afternoon, and again in the evening for a total of 9 sets of 10 during the day. It's okay to do more sets, but never less than 9 sets of 10. Very important exercise, and you really can't ignore this, and you must teach the patient this. And, when they first start, perhaps the first week, you can go over the regular exercise on the first page. But in the second week, you should teach them to do swallow. If you can, teach the swallow also on the first visit when we hand it out. When do we hand this out? We hand it out during the DHG appointment. And so they need to get used to learning the therapeutic bite in the hard guard position. So the second exercise is one of the more common ones. Obviously, exercise one every single patient gets because every patient gets a hard guard, a mandibular orthopedic repositioning appliance. Not everyone is deviating. Now, deviation is where they go to one side and then eventually come back to the center. Got it? So they go to the left, and then as they open more, they go bang into the center. They could open to the right and then eventually go right back into the center. This particular exercise prevents them from going right or left, but teaches them to open straight. The purpose of the exercise is to train the muscles and the joints to make a straight opening. And the concept is, if you do it correctly over and over and over again, that the disc inside the joint will reshape, that the structures inside the joint will eventually reshape. And definitely the brain will learn how to control any problems within the joint by guiding the muscles into a straight line opening. And I believe strongly that, if the patient does this over and over again, that eventually that will become the norm, and that's how the body will do it all the time. What is really fantastic is that most of the time, after patients have worn the more mandibular orthopedic repositioning appliance, putting them in their therapeutic bite for 6 weeks, everything corrects. It's amazing. Hallelujah. Some patients, even their necks correct. It's just craziness. But not everyone. So many TMD patients have internal inside jaw joint damage, right? They're actually parts inside of the joint are damaged. Either the bone is damaged, right? The ligaments that hold everything together are damaged, or the articular disc, the shock absorber, is damaged and shaped out of place or perforated with a hole through it. Whatever may happen, the thing's damaged. And when you have damaged items, they can't function. So if you've got a car that has damaged parts, twisted wheel, it's not going to function as well. But we're a biological system. We're human beings that we're made out of living stuff, and we can change. Now, naturally, the TMJ, temporomandibular joint, rotates 25 millimeters, just rotation, like a bicycle rotation, and then translates or slides until it reaches 40 to 50 millimeters of opening, of mandibular opening. Now, if the articular disc that sits between the mandibular fossa, which is the dome of bone, and the condyle, mandibular condyle, has slipped forward and gets stuck, this jaw joint will not be able to slide, so it can't do translation. It can open 25 millimeters in rotation, but then when it comes time to go beyond 25, it can't slide. And because it can't slide, as the person opens, they are going to deviate towards the affected joint, the joint that cannot slide. So the rule is you deviate to the side of the joint that is damaged. Got it? So as the patient opens, the opposite jaw joint slides, because that one's okay, but the damaged jaw joint just rotates and cannot translate. So during the first 25 millimeters of opening, you may see normal, maybe, or you could see deviation. But the damaged jaw joint, it will slide, the lower jaw will slide towards the damaged jaw joint. So as the patient opens, the opposite jaw joint slides, but the damaged jaw joint just rotates and cannot translate. The patient then deviates to the damaged joint. Now, if they deviate straight line, right, it's called deflection. and it never comes back to the center. So deviation by definition with TMD is to slide to one side and then eventually come back to the center when the articular disc pops back on. And some people don't. They will slide to one side and they can, it's a straight line. They never come back to the midline. That is called a deflection. But this exercise is given to patients who have worn their hard guards for up to 6 weeks and are still deviating to one side when they open wide, because we want them to open normally. We look at this stuff, right? These are the things that we're looking at all of the visits. We have patients come back continually because this is, I believe, that we are tweaking the process. We are letting the body heal and we're guiding the body's healing. It's a natural viewpoint. It's holistic viewpoint. And this is a very important way that we should be proud that we are doing this, that the patient continually comes back over that 6-month period of time and we reevaluate them at every single visit. And after 6 weeks, if they're still deviating, we're going to do this exercise. So in this first paragraph, we are educating the patient about what our goals are in this particular exercise, right? So you should have already completed TMD Exercise 1, training your jaw to get used to your new bite. And this would be also with the swallow. This new exercise, which is TMD Exercise 2, notice it's 2 because it's common, helps train your jaw to correctly open and close into your new bite in a straight up and down pathway, And they've got to do this in the mirror because they're training their jaws to go with what the eyes see. Your goal is to train your muscles to become comfortable in the new diagnostic bite and to effortlessly and automatically open and close in a straight line into your new bite. So they should bite into the therapeutic bite and open. And as they open, it's straight up and down, no left or right, right? And this patient obviously is not doing that. That's why we're getting them to do this particular exercise. And I call it passive because they're not using their hands or anything else. And a lot of people, it's the opposite. Passive meaning the hands are doing it for the jaw's doing nothing. But I call it passive. To me, passive means not using any other means to open or close. You're not using your hands or anybody else's hands. All right, so we continue, and it says, look into a hand mirror. And this is a large hand mirror. We've got them in the clinic, and they should be pulled out every single time. One of the things that gets me very frustrated is the lack of preparation because the assistants don't think. Like, what am I going to be doing during this particular visit? So and the DHG in exercise 1, there has to be a large hand mirror for the patient to see where their bite is, right? You shouldn't be telling them. I've actually seen assistants say, go ahead, bite there, bite there, bite there. Yeah, that's right. And then there's no hand mirror. So the patient is only going by the feel and the direction of the assistant. No. We want a large hand mirrors. You can get these at the dollar store, right? They're very cheap and always have them out. And if you're going to give them this exercise, correcting a jaw deviation, passive, exercise 2, you should, when you're teaching the patient, have a hand mirror there. You give the patient, not you, the hand mirror, so they can move that hand mirror back and forth to where they can see their front teeth. And then you're coaching the patient in this exercise. So remember, if you ever give this exercise 2, we need a hand mirror. Exercise 1, we need a hand mirror, a large hand mirror. So this is instructions to the patient. Look into a hand mirror to see how your lower teeth fit into your TMD appliance. At this point in your appliance wear, you should be able to naturally and easily find your new bite, your therapeutic bite. That's the concept of exercise 1. And the patient must learn the exercise 1 prior to 6 weeks. because we're doing a lot of stuff to get rid of the bulk of the appliance after they've learned it. They must learn exercise 1 at 6 weeks. That's the requirement. And you need to be monitoring this and watching this. So this exercise 2 really can only be done if exercise 1 has been completed correctly. Now, open your jaw and carefully watch how your jaw opens. If your jaw deviates to one side or the other on opening and or closing, then this is the correct exercise to do to correct this problem. So the patient is looking in the mirror, and as they open, they see their jaws jacking to one side, right? Or jacking to the left. Make sure when you're working with this patient, with the patient holding the hand mirror, that the patient recognizes this deviation. They can see it, they understand it, right? Because if they don't, they're not going to be able to correct it with this exercise over the next couple of weeks. And you'll have a total failure because you weren't a great instructor, a teacher, a loving, caring person. Please spend time making sure that they know this exercise. So we're going to continue again with correcting a jaw deviation passive. And we're telling these are written instructions to the patient and to you. You should understand these instructions. You should know if the instructions are being executed correctly. This is what you're here for. This is what you get paid for. And you are the loving, caring person working with the patient. Next, carefully control. That means don't let your jaw deviate. Next, carefully control your jaw when it opens and closes so that your lower jaw opens and closes in a straight line and finishes exactly into your new bite. So it can start at the new bite and then open straight, close straight, and go right into the new bite, into the new therapeutic bite. That was exercise 1, and they should know it. Do not allow your jaw to shift to either side when it opens or closes. You can hold a piece of dental floss straight up and down in front of your mouth to help you keep the opening and closing on a straight line. So they have to do this. Obviously, they can't be holding the mirror, but they can take the floss and go in front of their bathroom mirror with a lot of light and stay on that line so they can see themselves opening and closing. This is a very important concept, right? They need to be able to recognize that they're deviating to one side or the other. And then they have to be able to recognize if they're opening straight or not opening straight. Because the whole exercise is to correct this deviation, and with time, it will correct the joint. Next is correcting a jaw deviation passive. We're going to continue. At first, open and close very slowly, but as you become more comfortable, open and close a little more normally. Do not open fast or jerk your mouth open. Repeat this exercise 10 times in a row successfully, and then take a rest. Then do a second set of 10 and take another rest. Finally, repeat the exercise 10 more times. This is referred to as 3 sets of 10. And we use this whole concept of 3 sets of 10 throughout all our exercises. And you should always know what that is. And when you're training the person in exercise 1, you count with them. You go 1, 2, 3. Oh, you missed it. Let's start over again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Fantastic! You got your first set of 10 perfectly correct. Let's take a quick break and let's do the next one. All right, let's do the next one. See, so you're teaching the patient to do like weightlifting concepts, 3 sets of 10, of correct 10. And they need to be able to do this in front of their mirror that they hold. They can either use a mirror and they can bring it at work, or they can go home and do this in the morning before they start their day after they brush their teeth. And then before they go to bed, they can do 3 sets of 10 also. So this is so incredible, and I'm trying to teach you to be a pro. I want you to be outstanding. That's why we're doing these videos, so that you'll be outstanding. And what will happen possibly is you'll give this exercise 2 to the patient. Maybe you're great. maybe you're going to sit there and drill that patient and coach the patient so they know what they're doing. But really fantastically great would be when they come back on their next visit for you to remember to have them demonstrate successfully this exercise so you know they did it, so that you know they are correcting this deviation because you care about the patient and you care about the results you get. I am so over, I know in physical therapy, so many physical therapists, they do their thing and they don't care whether the patient is corrected with their neck or not. They don't, you know. And the problem is the patient falls in love with the physical therapist who's getting no results. I hope that you're better than this. I hope that when you give exercise 2 to the patient, that you're going to look back in the notes prior to seeing the patient and see, oh, gee, I remember when I gave Mrs. Jones this exercise 2, and I work with her one-on-one. Let's see if she's been doing it, number one. Number two, let's see if she's been doing it successfully. And number three, did she correct this deviation now? Is it gone? You know, that would be so good. That would be a day to celebrate where you can feel like you've done something significant in life and you've helped someone, because that means if they continue to open and close directly straight, their joint is going to heal amazingly, because form follows function. The shape internally of the joint will follow how that joint functions. And so you're teaching them some amazing stuff. So I pride myself at following up and evaluating patients to see, you know, if we've corrected them. My goal is a healthy jaw joint, healthy person. And I'm proud that we look and see if we got the results that we want to get. There are so many things. You know, we put a little checklist of all the problems that patients have, and one of them is this opening and closing problem where they deviate. So they've completed exercise 1, and they now are excellent. They can get right to the bite position, and that's going to make a beautiful 3-dimensional healing position for all the guts inside that joint to heal. But it's not function, right? Function is movement. Then they're deviating, and we give them exercise 2. They go home, and we make sure that the patient's been doing the exercise correctly, but we see that, geez Louise, this patient is not getting better. They're still deviating. Okay, because we watch. If we don't watch, we're stupid, right? We don't care. And I'm just trying to tell you this. We watch. We've given exercise 2. You see it in the last visit in the clinical notes, Dentrix notes, and they come back now, and geez Louise, they're still deviating. So now we need to teach them to use their hands to correct the lower jaw because the muscles are not able to do it. So in other words, in exercise 2, the patient is using their own chewing muscles to control the movement of the jaw. They're tightening and loosening to open without anything touching the jaw. Now, that hasn't worked as well as we want. So now we have to teach the patient to use their hands in order to correct this deviation. It's really kind of important that we look and see, was exercise 2 successful? If exercise 2 was not successful, then we go to exercise 3. So if you understand the different exercises, you know when exercise 3 is used. So TMD exercise 3, correction of a jaw deviation with resistance, is given to TMD patients who are still deviating when opening, even after being given TMD exercise 2. And so they come back and they're still deviating, and you sit with them and you look to see if they're doing exercise 2 correctly. And if they're not doing exercise 2 correctly, reinforce the exercise, teach them the exercise, get the mirror out, and make sure it's being done enough. If, however, it seems like they've done a great job and they know what they're trying to do and they know what they're doing, but they're just not successful, then we're going to go to exercise 3. Exercise 2 is done just with the patient opening and closing herself with her own jaw joint muscles, all the muscles that support the jaw joint. Exercise 3 uses the patient's hands to prevent the jaw from deviating on opening by holding the jaw and gently pushing on it so it opens straight. So it wants to go to the right, but the right hand won't allow it. The right hand will push it and guide it open. You got to do it in front of the mirror. Patient must do it in front of the mirror. So as they open with exercise 2, they're going to deviate. But with exercise 3, as they open, they're going to deviate, but you take the right hand and push it back to the center on opening. Same would be true if they're deviating to the left. Patient's going to take their left hand and open and keep it open till it's straight. So the patient is using his or her hands to make a straight line opening. So it's saying this exercise is similar to TMD exercise 2, correcting a deviating jaw, passive, except that you will be using your hand to apply an opposing force against the deviation, away from the deviation. You're holding your hand against your chin while making the correct up and down, straight up and down jaw movements. Now we're going to go back to 2, repeat TMD exercise 2 several times and ensure that you are opening and closing on a straight line without deviation, without touching your jaw with your hand. But obviously we're doing this particular exercise because they're not doing that. So you're making them do that. Mrs. Jones, could you open and close straight for me, please? And you watch, and they can't do it, all right? And then you say, how many sets of 10 have you been doing? Well, I've been doing at least 4 or 5 sets of 10 each day, and it just hasn't been successful. And so now you're ready. You're confirmed that you need to do exercise 3. So now it goes on to give some more information. Now, TMD exercise 3 strengthens the jaw muscles so that your jaw muscles will become more effective in preventing your jaw deviation. Stronger muscles are better muscles. The easier it becomes to open and close correctly, the more chance your temporomandibular joints, your TMJs, have to heal correctly. So if they open and close correctly, they're going to heal better. And as you guide it to the right, you're taking over the muscle function in order to get that muscle used to opening and closing with the assistance of your hand. So you're teaching the muscle the correct direction. Does that make sense? And as you move open and closing, you're contracting that muscle, getting it stronger as you're opening and closing with your hand, preventing it from deviating. So it's really the TMD assistant's responsibility and duty to assist the patient in achieving excellent results. It's kind of like you're a physical therapist of the mouth, right? But you need to be concerned that you're getting good results. And so we are inviting patients, because sometimes patients, even though they can't complete it correctly, they won't say anything. They might be improving. They're out of pain. A lot of patients within 6 weeks, they're completely out of pain. Sometimes within 2 weeks, they're out of pain. And that's all they were concerned about when they came. But we want optimal health. We want optimal everything, right? We want the patient healthy as sin. And you need to follow up. And here we're inviting the patient to contact you to be sure that they're doing it correctly. If you're having any problems, then this is an instruction to the patient. Schedule an appointment with the TMD assistant. This exercise can also be done with another person holding your jaw. After the demonstration with the TMD assistant, you can then do exercise 3 in front of the TMD assistant to be sure you're doing it correctly. So you can sit in front of the patient holding a mirror, and as the patient opens, you cup your hands, if they're open to the left, on the left, and push it till it's straight. And you're showing the patient how to push it to keep it straight. You're doing it, not the patient. Then once the patient gets the idea of the pressure and what needs to be done, next you have the patient do it in front of you successfully. Do not dismiss the patient if the patient cannot do this exercise, because then you're just a fool. You're not really a caring, loving person. You want the patient to do well, like your kids. You have kids, you want them to thrive and do well. Think the best for the patient, want the best for the patient. So at first, open and close slowly, but as you become more comfortable, open and close a little more normally. And have them go slowly so they can see in the mirror. Do not open fast or jerk your mouth open. Repeat this exercise 10 times in a row successfully and then take a rest. Then do a second set of 10 times in a row correctly and take another rest. Finally, repeat the exercise 10 more times. This is referred to as 3 sets of 10. And we've been saying this over and over. We did it in exercise 2, and we're doing it in exercise 3, and exercise 1. 3 sets of 10, several times each day. Do 3 sets of 10 3 or 4 times each day and report your results to the TMD assistant at your next visit. So we're asking the patient to interact with you, report how they're doing, but you should also be concerned because a lot of patients, they're out of pain and they're not going to do the exercises, or they do the exercises and they don't do them successfully and correctly. You have to intervene. You are a quality control person to be sure everything is done right. So this handout is given to people usually whose masseters or beaver muscles on the side of their face are extremely tight and they haven't relaxed the way they're supposed to. So what happens is when they get so tight, they block off and compress and shut off the blood to the muscles. So now the tight muscle can't get any blood, which makes it worse because then all the toxic stuff from the clenching and grinding build up and they never get cleaned out. The heat opens up the blood vessels, relaxes the muscles, and brings the blood in to clean out and remove all the toxic materials. It also relaxes the muscles. Sometimes muscles just clench and they forget to relax. They need to learn how to relax again, and heat assists this. We also use this particular exercise when we have people that come into our office who cannot open, and we can't get a impression. So they can't open, and they're usually 10 or 15 millimeters, but most people can go to 25 because that's rotation. So the jaw, as you remember, opens in rotation and then slides forward in translation. Translation is sliding doors. Rotation is just regular doors. And we will apply this heat to the side of a patient's face in order to make them open a little bit better. And we'll also do some massage, internal massage with forefinger and thumb in order to get the patient open. Again, the reason the patient is usually shut and not able to open is they're trying to protect the joints that have damage in them. But we need to open it up so we can reposition the joint into a healing position, a position that is harmonious with the joint, not the position that the patient came in with that is damaging the joint. So this is TMD Exercise 3A. So TMD Exercise 3A is home heat therapy. It relaxes the patient's muscles with moist, wet heat and stretching, opening and closing stretching. It's used when the patient's muscles are super tight, and these muscles won't let the patient's mouth open. So won't let the patient open her mouth. So muscles that are really tight, muscle bound, an athlete a weightlifter that's muscle bound can't move his muscles well, right? They're too big. And the same thing is when muscles have been chewing, grinding, they get so tight that they shorten and they can't relax. And so we need to get them to relax. This exercise can also be used for oral surgery patients who are healing slowly and have muscle spasm associated with previous oral surgery. So sometimes at a 1 week PO, a oral surgery patient will be unable to open. And most of the time, I mean, you'll look in and the healing is fantastic, right? Fantastic healing. But the patient can't open. And what that is the muscles have been injured, held too long. Sometimes the needle will actually damage the medial pterygoid muscle, and the muscles are all so tightened. So we will often give this exercise to patients who have normal right and left lateral movements, but who cannot open 40 millimeters or more. So in order to go 8 to 10 laterally, you've got to be able to rotate and translate. Got it? So 8 to 10 to the left, that means the right joint is rotating and translating correctly. To the right would be the left joint is rotating and translating correctly. The joints are fine. So it's not the joints that are limiting the opening. It must then be muscles. So again, home heat therapy. What is it for? Warm, moist heat brings blood to sore muscles. The moist heat opens up the blood vessels that go into the muscles, and this increased blood supply helps bring more food and nutrients to the sore jaw muscles. The increased blood flow also removes unwanted wastes. You'll be combining stretching of the jaw muscles with the moist heat to help you heal more quickly. So we're going on to teach the patient how to do this, with the little hand towels. Run the hot water in your bathroom or kitchen sink until it's hot, and then fill up the sink with the hot water. So you can put a little plug in there, or you could just run the hot water directly onto the towels instead of filling up the sink. Be sure that the hot water does not burn. Place 4 terry cloth hand towels into the hot water. Take, take 2 of the hand towels out and squeeze the water out of them. Be sure that the water is not so hot that you can't handle the towels with your hands. That's a bad sign, huh? Fold each terry cloth towel into 4. Place 1 hot moist towel over the right cheek and a left moist hot towel over your left cheek. So you both sides, and you're going to hold it there for a few minutes. Gently open and close your mouth as much as you comfortably can open with the hot moist towels over your cheeks and jaw joints. Knead, it means rubbing with your fingers into the outside of the cheeks. Knead the towels over your cheeks in a circular manner. Push and rotate, push and rotate. Apply gentle rubbing, polishing type pressure onto the towels as you push and knead the towels into your face. When the towels become cold, put them back into the hot water. Take the other 2 towels out of the hot water, wring them out. Place the new 2 towels on the same places on your face. Continue opening and closing. This is really important. We're teaching the patient to have the second hot towels ready. Sometimes they have just 2 towels and then they have to take it off their face, run the hot water, and that slows things down. Having the second 2 already hot and ready to grab, they can immediately put them back on the face. After 5 to 10 minutes, or if your jaw relaxes sooner, open as wide as you can and place the index finger of your right hand on the 2 front lower teeth. Gently press downward to force your jaw a little bit open more. Then open and close without using your finger. Repeat this procedure again. Now we're stretching. That's what they're doing. They're stretching the muscles that have had some blood come into them. Some of the toxic wastes are being released. Now gently press downward again to force your jaw a little bit more open, then open and close without using your finger. After 3 times, change the towels and open and close as wide as you can without your finger. So they're using the heat at first when you're kneading their face up, and they're getting the blood to come into the muscles and the blood to go out with the wastes. And now next we're like opening and closing passively without assistance, what with the heat on there. And then eventually now you've got a problem because you gotta use your finger, which means one towel is not gonna be able to be held, but then you open, stretch a little bit, let go. Open, stretch a little bit, let go. Then open and close without stretching with your finger, and then put the heat back on. And just keep on doing this. This is physical therapy. So again, we're going over this exercise more and more. I think it's really important. This really helps take care of a lot of the pain. A lot of the pain the patient has is muscular, and this can be on the forehead, on the side, on the neck. You can use this heat anywhere in the body where there's a problem. And we're instructing the patient again. Remember not to use much force. Be gentle. Do not force your jaw open. Be patient. It may take several days to fully relax your muscles. Be patient. Take a deep breath.